I'm going to start with medical terminology. And so what I want to do is, even though you guys already took these, there may be a couple of you that were absent and you missed. And since tomorrow is the last day, we unfortunately don't have an opportunity for you to go back, but that is fine. That's the reason why we are going over this on today. So what I would like to do is I would like for you all to be able to answer these questions. So I will start with the first one. The suffix "scopy" means?
Visualize through a scope.
Visualize through a scope. That is correct. If the doctor wants a test done immediately, he wants it done
Stat.
Right now. All right. The prefix below is
Hypo.
Oh,
A medical administrative assistant is asked to schedule a chest x-ray for a patient. The assistant should make an appointment for which of the following?
X-ray of the chest.
X-ray of the chest. Medical administrative assistant in a multi-specialty practice is scheduling an appointment for a patient who has an arrhythmia. The assistant should schedule an appointment with which of the following providers?
cardiologist.
Cardiologist. One of the things I will tell you that's just important to note is that in the past, individuals that have taken the test have commented on there are some questions that they see on the exam, and they're like, I've never seen those words before. So what do you think you need to do in those situations?
Break it down to the root, the prefix, and the suffix.
And
You break it down from the root to the prefix and the suffix. If you read it back, you should go from the suffix to the prefix and the root. You should come up with a complete word and a meaning.
All right. And process of elimination. You know what I mean? You gotta look at the ones that you know so that you can then, make a determination on what actually would be the correct answer. And you also have to resolve that sometimes, you may not have the answer. So don't try to get 100, just try to pass. Especially for all of those folks who like to get A's on everything. All right, next up. Which of the following words means to swallow?
Are you able to make that screen a little bit bigger?
I said the second one. I can't pronounce it.
Yeah,
The second one.
Yes, pharynge. All right. Which of the following prefixes mean muscle?
My.
A patient's chart indicates the need for a PT as a result of a strained muscle. Here's the other thing. Sometimes you have abbreviations that are, that they look alike, but they have different meanings. So the answer for this one is?
Physical therapy.
Physical therapy. Prothrombin time is also a very common abbreviation used for PT. Which of the following methods organizes patients' records into chronological order? And something I will tell you from previous courses, if they don't, if they don't read the packets, they find that they struggle with these specific types of questions. So this would be a problem-oriented medical record, POMR.
I knew it was that one or the third, the last one.
And it is in your packet. A provider asks a medical administrative assistant to schedule surgery to remove the patient's gallbladder. So that would be
The last one.
Last one.
cholecystectomy. All right, next up, which of the following word roots means abdominal wall?
Adeno.
So adeno is actually gland. It would be lateral. Lateral. All right. Which of the following medical terms refers to the removal of all or part of an organ or tissue?
Epistemomy. How do you pronounce that?
Episiotomy.
Yeah.
So here's the thing. The word is removal. Which of those suffixes mean removal?
Oh, it's lymph. I can't pronounce it.
Yes, it's lymphadenectomy. So the key here is, I don't know who said it, break the words down. So if it's removal, the last three are all incision. All right. Which of the following is a disease-causing organism?
Pathogen.
A pathogen. Patient has Crohn's disease, should be scheduled with which of the following specialists?
Gastroenterologist.
Gastroenterologist. Patient has hypertension. Which word describes hypertension?
High blood pressure.
High blood pressure. Here's something else. Don't read so fast that you skip a word like high blood pressure versus high blood glucose. On the exam, you are going to have like a scratch sheet of paper. So, you know, if you need to write notes for yourself, that will help you avoid making little tiny mistakes. All right. Which of the following sections of a patient's progress note contains the reason for the visit? And that is the chief complaint. Chief complaint. All right, next up, a provider refers a patient to a specialist for carcinoma. Which specialist would that be?
Oncologist.
It would be the oncologist. Which of the following prefixes means masculine?
ANDR.
ANDR. A patient prescribes an EKG for a patient who has a rapid heart rate.
Tachycardia.
Tachycardia. Tachy is fast and Brady is slow. Nia, the P is silent, like in pneumonia. Nia is breathing, and cardi, as you know, is heart. Patient who smoked previously on a regular basis, but no longer smokes. Which of the following abbreviations represent the section of the medical record in which you will find that information?
Would be PH.
Yes, for past history.
As history.
All right, next up. To which of the following departments should a patient go for a WBC count?
Laboratory.
It would be the laboratory. Which of the following prefixes means abnormal?
This.
This.
This, yes. Wait a minute. This is difficult, painful, bad. So not this,
AB.
AB.
Yes.
Which of the following is the abbreviation for, watch this word, electroencephalogram?
ECG.
ECG.
EEG.
EEG.
Oh.
Yes.
EEG.
EEG, encephalogram. Which of the following abbreviations would be used to document a patient history of stroke?
CHF.
CHF is congestive heart failure.
CVA.
CVA, a cerebral vascular accident. Which of the following is abbreviation for a type of routine blood test?
CBC.
CBC. Provider asks the MAA to schedule a patient next appointment for arthrocentesis of the shoulder.
It would be the surgical puncture to remove fluid from the right shoulder joint.
Yes, centesis is a surgical puncture. Which of the following suffixes relates to falling or prolapsing? P is silent,
The PTOSIS.
which is ptosis.
Ptosis.
P is silent.
I can't
All
say
right.
that.
Which of the following conditions is appropriate to schedule with a gastroenterologist? I know you know this answer.
That's me Crohn's.
Crohn's. Mhm. Which of the following describes the presence of several large kidney stones?
The first one.
So seal is a herniation.
Yeah.
Okay.
So it's the last one, nephrolithiasis. MAA is entering laboratory charges for a patient whose results indicate a high concentration of fat in the blood. What would that be? Fat.
Hyperlipidemia.
Hyperlipidemia. A spirometer measures the function of which of the following organs?
Lungs.
Yes, it is the lungs.
They feel relieved.
A patient who has pleural effusion needs a therapeutic procedure to remove unwanted fluid.
Paracentesis.
MAA is scheduling a patient who is pregnant for a diagnostic procedure that does not use ionizing radiation.
MRI.
A CT.
A CT.
CT.
Now, this is, one second, I got some windows popping up. This is one of those questions that you could potentially see that you're like, I have no clue. And what you don't want to do is spend 10 minutes on this question. Why?
Because it's timed. You're missing out on other questions that you could be answering.
Right. And you don't have to get what?
100.
Yeah.
Just pass it.
You don't have to get 100, right? So don't allow the test to throw you off and you spend 5 minutes looking at the screen. So the answer is at MRI. It does not use ionizing radiation. MAA is scheduling an appointment for a patient who has a history of decreased renal function. What test would that be?
TSH.
THS is thyroid stimulating hormone.
Yeah.
So would it be the BUN?
Yes, blood, urea, and nitrogen.
Sorry, that was.
And LFT is a liver function test. A provider prescribes a UA for a patient who has an infection. What condition are they potentially testing for?
A UTI.
Mhm. Which of the following suffixes mean to cut into?
The OTOMY.
Octomy. All right. A patient has Parkinson's disease. MAA should schedule the patient for which of the specialists?
Neurologist?
Neurologist.
MAA is working with a mother who is receiving care after birth of her newborn.
Postpartum.
Postpartum. Which of the following describes narrowing of the spinal cord?
Spinal stenosis.
Yes, stenosis means narrowing. The suffix meaning inflammation is
Itis.
One who studies and practices medicine related to the nerves.
Neurologist.
Neurologist. The skin is part of which system?
Nervous.
Integumentary.
Integumentary, yeah.
The combining form hepato. Like hepatitis.
Liver.
And sometimes you got to put the word, like make a word, not make a word, but you know what I mean? Like think about it from the perspective of a word. All right. The heart has how many chambers?
4.
What's a drug reference that can be used, or what's a reference that can be used to check for correct spelling of drugs?
The physician's desk
Reference.
Yep, also known as the PDR. And I told you that this test really, there's a lot of what I would consider old terminology because there's not a lot of offices sitting with a PDR on their desk. They are going to Mr. Google. All right, next up, the abbreviation LOC is
Loss of consciousness.
SOB.
Shortness of breath.
HTN.
Hypertension.
DOB.
Date of birth.
And NPO.
Nothing by mouth.
Nothing by mouth. All right. So we are going to go to our next one, and I'm basically just working backwards. So we are going to go to general office procedures. Which of the following actions should the MAA take when closing the office?
Activate the security system.
This is another question. I mean, I know that there's still small practices out there where this probably applies, but you can see that some of the content you're like, I don't know if they're doing that today. But anyway, the part of the letter that immediately precedes the signature.
Closing.
One second, let me make the window bigger. Oh. One second.
An hour later, I am playing. Then at 6 p.m., he goes all caps, watch your backstage. 4 hours later.
Somebody's got another whole meeting going on in the background. Okay, Which of the following is used to edit, enter, format, and print letter documents?
Word
Word
processing
processing
program.
program.
The MAA is asked to create labels for a patient's practice. Which word processing feature would you use?
Mail merger.
Mhm. Which of the following should the MAA, which actions should you take when answering the phone?
Answer
Telephone
telephone
call
calls.
for third ring.
I don't know, I called a business yesterday, Starbucks in particular. It rang about 10 times and nobody answered the phone. They made my drink wrong too.
Yeah.
All right. They still haven't answered the phone. I called back today. All right. Which of the following types of correspondence can be written and signed by you?
A letter to a patient about scheduling changes.
Yes. Which of the following actions should the MAA take during the closing procedures?
Procedures.
Didn't we already say arm the security system?
We did. So you can see the same question more than once.
Okay, that threw me for a loop.
I thought that was a trick question.
I was like, wait, we already answered that, didn't we?
Using the BCC option when sending an email does which of the following?
Protects
Protects the privacy of each recipient's email.
Mm-hmm. Mm-hmm. I can't stand when people send out an email and it's got 500 people copied on it. It just drives me crazy. But then people like to do a reply all, and now everybody is getting that in on that whole conversation when we don't need to be. All right. When performing closing procedures for the day, which of the following should be secured with a lock and key?
The provider's prescription pad.
Yeah, and again, I don't know about you, but I haven't seen no prescription pads laying around the office lately.
No.
None, none.
No, because you know, people, they like to sell stuff. All right. After deactivating the security system, which action should you take the next day?
That's the answering.
That's the answering service.
Mm-hmm. Microsoft Excel is what type of program?
Spreadsheet.
Spreadsheet. MAA is creating a business correspondence. Which of the following salutations is appropriate?
The first one, dear Mr. Goodwin.
Mm-hmm. Style in which all letter parts begin at the left margin.
Full block.
Use and change of tone or pitch and voice.
Inflection.
Inflection. And lastly, specific words or expressions that can be used by a particular professional or group.
Jargon.
Jargon. All right. And again, I am recording this, so you can go back and replay it. Next is patient education, a list of guarantees for people receiving medical care.
Explanation of benefits.
Explanation of benefits. Are you sure?
I think it's assignment of benefits, right?
So explanation of benefits is that paper that the patient gets in the mail that says this is not a bill. Assignment of benefits is where the patient tells us it's okay for the check to come to us.
Also, then it's Bill of Rights.
All right.
Mm-hmm. Okay. Written recommendation to a specialist.
Referral.
Girl.
Which insurance most likely needs a referral?
HMO.
HMO.
Okay. Patient and a provider decide to work together on a treatment plan. What is that called?
Shared decision making.
Mhm. Type of consent where the patient presents for treatment, such as extending an arm to allow venipuncture.
Implied.
Implied.
Implied. Consent for treatment given out loud.
Verbal.
That is verbal. Providers explain medical or diagnostic procedures, surgical interventions, and benefits, and the risk involved, giving patients an opportunity to ask questions and consent before medical intervention is
Informed.
it is informed. A document that outlines all of the supplies and services, the amounts billed by the provider, the amounts paid by Medicare, and what the patient must pay the provider for the preceding 3-month period.
Is it a RA?
RA is the letter that is sent to us.
So MSN.
Yeah, so Medicare, they don't call it an EOB, they call it a Medicare summary notice. Health insurance subsidized through premiums paid directly to the company.
That's private health insurance.
It is private health insurance. Preset amount set by the insurance company and paid regularly, usually on a monthly basis.
Premium.
Premium.
It is the premium. Like your car insurance, even though some people pay their car insurance, for 6 months, but most of us, well, I'm gonna say, talk about me. I pay mine monthly. I don't do 6 months. Federally funded health insurance plan for people 65 and older, people younger than 65 who have certain disabilities, and people of all ages with end-stage kidney disease.
Medicare.
Yeah.
Medicare. Time during which benefits are payable under a given insurance plan.
Benefit period.
It is the benefit period. Provides hospitalization to eligible individuals.
Medicare Part A.
May.
Mhm. Voluntary supplemental medical insurance to pay for physicians and other services not covered by A.
Medicare Part B.
Mhm. The first prepaid plan in the US to offer insurance.
Blue Cross
Blue
Blue
Cross
Shield.
and Blue Shield.
They used to be called just Blue Cross. And then they became
The Blue
Cross
Shield.
and Blue Shield. A contract between employers and private insurers. This is
Now,
a
this
word.
one was a toss-up because I think I put down HMO, but it might be a PPO. I was a little confused on that one.
I think it's a ASO.
It is an ASO,
Yes,
and
sir.
it is in that packet that Mr. Pugh gave you. Insurance that is tied to an individual's place of employment.
Employer-based insurance.
Employer-based insurance.
Mhm. Program jointly by the federal government and the states to cover uninsured children.
SCHIP.
The S chip. Mhm. Organization developed to manage the quality of healthcare and control costs.
A managed care
Managed care
organization.
organization.
Mhm. Next, the fixed amount a provider receives per member per month.
Capitation.
Capitation. And so just so you are clear, what this means is the patient or the provider receives a monthly check for every person that is signed up under their plan. All right, formal approval from the insurance company that it will cover a test or service.
Pre-authorization.
Pre-authorization.
Plan that allows patients to use specialists and all those other people and receive a greater discount.
HMO.
That's the PPO.
ACO.
That's the PPO. Government-based health insurance that pays for individuals that have low income or limited financial resources.
Medicaid.
Medicaid. A predetermined amount after which the insurance company will pay 100% of the cost.
Out of pocket maximum.
Mhm. Private run insurance for Medicare for prescriptions.
Medicare Part D.
Medicare Part
Yep, D for drugs. That's the easiest way to remember that. D for drugs. Form provided to a patient if we believe that the service may be declined.
ABN.
ABN, the advanced beneficiary notice. Model in which providers set the fees for services and procedures.
Fee for service.
Fee for service. Combined package of benefits under Medicare A and B that will pay for other stuff.
Medicare Advantage.
Used to be called Medicare Choice because they felt like, you know, the Medicare patients was getting a choice, but then they realized that they was getting sucked into a gate. They had to get permission to go outside of the gate. Plan that allows patients to only go to physicians, hospitals, except in an emergency.
HMO.
Because they got to get permission. Plan that allows patients to go to any physician, healthcare professional, as long as those providers treat those patients.
PPO.
Anybody with another thought?
MA.
MA is actually Medicare Advantage. So it would be a private fee for service. Long as the provider agrees to treat those patients. Willful and unlawful use of intimidation and physical force.
Assault and battery.
Younger than 18 or younger than the age of majority, who is usually 18.
Emancipated
minor.
That's the folks that want to be. The folks that want to be grown. All right. Next up, one of my favorite areas. Compliance. I love compliance. All right. A patient submits $15 each time he receives treatment. What is that called?
A copayment.
Copayment.
Which of the following describes the purpose of general duty clause as outlined by OSHA?
It requires employers to maintain a workplace free from hazards that might cause serious harm or death.
Which of the following insurance plans provides coverage for patients 65 and older who have
Medicare?
And then you see some of this information crosses over.
Yeah.
Transfer of information in a standard format.
EDI?
Yeah.
Electronic data interchange. What should the MAA use to determine the proper way to dispose of an expired chemical cleaning product?
MSDS.
MSDS, Material Safety Data Sheet. MAA is reviewing a release of information form for a patient who is a dependent minor. The assistant should ensure that which of the following signed the release form?
The legal custodian.
The legal custodian. Because it may not be a parent.
That's right. I should know that.
All right, next up. In addition to a witness and the adult patient, which of the following individuals must be present for an informed consent signature?
Provider?
Yep. because they got to explain, everything. Okay. Which of the following is an OSHA regulation that must be reviewed yearly?
Blood pathogen standards.
Mhm. Which of the following documents must the MAA provide for a patient to submit reimbursement?
An encounter form?
It is an encounter form, because sometimes sometimes patients don't want us to bill the insurance. They will go after the reimbursement themselves. So we have to give them the encounter form so that they can submit. Which of the following information is acceptable to request on a patient sign-in sheet?
The appointment time.
Because that right there is not tied to nothing.
Right.
A patient should sign which of the following forms in order to authorize payment directly to a provider? We talked about this a little while ago.
Assignment of benefits.
So they're saying that the money should come to us and not to them. All right. In which of the following situations is it allowable to release the patient's medical record?
When a court requests a record through a subpoena.
ABN informs the patient that the service is not likely to be covered by which of the following insurance?
Medicare.
Medicare is correct. Which of the following is a MAA required to obtain before providing the patient's PHI?
Assign release
Like
of
inside-
information from the patient.
When a hazard is present in a facility that is not specifically addressed by OSHA, what should we do? Or what should we know?
The first one, the employer must use the guidelines from the most applicable existing standard.
The employees are covered by the general duty calls. I'm gonna say this one more again. Make sure you read that packet. Okay, now the office logistics. Okay, we're gonna get the first one. Which of the following is appropriate to purchase with petty cash?
$75 gift card.
Don't think about yourself. Think about the
It's the
organization.
post is old.
It's the
for-
postage.
Yeah.
Oh, for it.
Always think about what you could get out the deal. An office manager asked the MAA to mail a letter to a patient who's being fired. Dismissed. How should we send it?
That should be certified.
Class mail.
Certified mail. Which of the following medical record systems protects patients' privacy and allows for unlimited expansion in a high volume clinic?
Numeric.
Numeric. MAA creates an invoice for the remaining percentage of the encounter fee after receiving the copay. Key here is percentage.
Co-insurance.
Insurance.
Yes, because co-payment is a small fixed amount, co-insurance is a percentage, and it's going to vary based on the plan. Which of the following mail services is most commonly used by medical facilities?
First class.
A fixed fee for a service or medication.
Co-payment.
Co-payment, because you can have a co-payment for medication as well. A HIPAA rule that establishes protection for the privacy of the individual's health information.
Privacy rule.
Rule.
Patient receives an EOB, which states that the services will not be covered because of out-of-pocket medical expenses have not been met this year. So they have not met their what?
Deductible.
Deductible.
Deductible. Mhm. A list of items in a package.
Invoice.
Yep, invoice.
Packaging slip.
Package.
This the package. I would get invoice.
Invoice is asking for you to pay it.
That's right. It's a list of items in a package.
And they ain't sending y'all nothing nowadays unless you pay up front. Okay. Which of the following documents must an MAA provide for a patient to submit for reimbursement?
An encounter form.
Of note, an encounter form is also known as a super bill or a charge ticket.
Yeah.
Which of the following party is financially responsible for payment?
Guarantor.
The guarantor. First class mail weighing more than 13 ounces.
Priority mail.
Mail that includes advertising, promotional, editorial.
Standard.
They call it standard, I call it junk.
Junk mail.
Sealed or unsealed, typed or handwritten material, including letters, postal, postcards, business.
First class.
First class.
First class. Mail that has insurance against loss or damage.
Insured.
Mail of all classes protected by registering and requesting evidence of its delivery.
Certified.
Certified.
Registered.
Registered.
Registered. Ooh,
Yep.
Registered.
The properties owned by a business.
Asset.
Assets.
A request for payment.
Invoice.
Statement.
No,
Yeah, we
it's
just invoice.
Invoice or a statement.
I'm going to say a request.
I would say a statement.
Statement.
It's a statement. What is
I
left?
get a statement.
What is left of assets after creditors' liabilities have been paid?
Equity.
Equities.
The equity of those to whom money is owed.
Liabilities.
Liabilities.
Yeah, well,
All right, here we go. A document that shows the items purchases or services rendered and shows the amount due.
Invoice.
That is an invoice. The record of funds distributed to specific expense accounts.
Petty cash.
no.
I would say
Disbursement.
disbursement.
Disbursement. A record of patient fees submitted and reviewed by the insurance company in a form letter sent to the patient. This is not a bill.
EOB.
EOB.
EOB. Document that provides detailed information about charges and remaining amounts owed to the provider.
Accounts receivable ledger.
A model in which the provider set the fees.
Fee for service.
Yeah.
Yeah.
No longer fee for service. It's more like a discounted fee for service. System that provides national uniform payments after adjustments across all practices throughout the country.
RVS.
Voluntary supplemental medical insurance that covers services not covered under Part A.
Is it Part B?
It is Part B. So once you get retirement age, you automatically can get Part A, but Part B, you actually got to enroll in it. A form of sharing that kicks in after the deductible has been met.
Co-insurance.
Co-insurance. Part of the office's functions to include recording, classifying, and summarizing financial transactions.
Bookkeeping.
Bookkeeping.
Every time I hear that word, I just want to vomit. Seriously. Documents or bits of information that identify the person or provide enough so that the person can be identified.
Individually identify health
Identifiable
information.
Information.
Generally, medical practices tend to use blank basic filing systems.
I'll say 2.
The 2 seems good.
Usually. Hey,
3.
It's
3.
3.
It is 3.
A
Remember you
backup
got
for the backup?
Right.
no, remember you got alphabetical, numeric, and then you got
Nice.
subject.
Okay, I forgot about one.
Yeah.
All right, on to patient intake. Which of the following types of referrals are used in an emergent situation?
That.
It is that. Before adding reports to a patient's chart, the MAA should take which of the following actions? You don't want to just be throwing stuff in the chart.
ensure the provider has
Right,
initials the
initially.
reports.
Yes, because as you as the patient, you want to make sure he looked at it.
Mhm.
All right. Next up. Which of the following should a MAA explain to new patients prior to initial visit?
The procedure to cancel an appointment.
That's right.
Or you're gonna have a fee.
Mhm.
For medical billing purposes, which of the following is good practice when updating information from established patients?
Request verification of current patient.
Yep. You want to
Request verification of current. I'm sorry, I was reading it and thinking, say, wait a minute, am I right? So the last one.
Yeah, so you want to make sure for each and every
Then nothing has changed.
When reviewing laboratory results, a MAA should take one of the following options.
Place the results on a clinical. No. Place the results on the provider's desk for review.
Once a physician signs advanced directives, who should witness it?
Family member.
I want to say a non-affiliated individual.
You don't want anybody that's got some ties to the situation. Which of the following describes the birthday rule?
Now this one I know I got wrong. Because I put down the parent whose birth month and year is earlier, but it's actually the parent whose birthday is first.
Right? Doesn't matter what year they were born in, it is the day.
The day of birth. So it's the first one.
First one. MAA is giving instructions to a patient who is in the office to have hearing aid checked and is having difficulty hearing.
Sit side by side with the patient while speaking.
Move the patient to a quiet location.
Quiet location.
Oh, yeah, yes, ma'am.
Which of the following is the party? We know this one, who is financially responsible.
Yeah, the guarantor.
Guaranteed.
My daddy.
A patient presents to the provider's office with flu-like symptoms. Don't come in.
Please don't.
Move the patient to an isolated.
Isolated location.
Uh-huh.
I was with the first answer. Don't come in.
Oh, that's what we say now because of COVID. Don't even show up. Prior to leaving the office, the patient is asked to pay 10% of a $100 office visit.
That's co-insurance.
So insurance. MAA receives telephone calls from 4 patients. Which one needs immediate attention?
Patient who reports
Who's
difficult
Difficulty
breathing.
breathing.
Mm-hmm. What is the purpose of an encounter form?
To establish financial responsibility.
It's actually to save time.
Pay time and
Yeah.
and improve accuracy.
At which of the following times should the MAA pull a patient daily chart?
When the patient calls.
The evening before the patient's appointment.
Mm-hmm. Yeah. Which of the following is the best way to address collection of a copayment?
How much would you like to pay today? No. What method of payment will you be using today?
Yeah. Yeah. What method of
My
payment?
eyes is playing tricks on me.
We don't want to
When
give them
can
a
we
choice.
expect your payment?
That's right.
We don't want to give the patient a choice. What method of payment would you be using today? Not when can we expect it?
Yeah.
Remember, every copay you take can be part of the money that they use to pay you.
Yeah, that's right.
Okay, which of the following action is required by a patient when requesting a copy of their medical record?
Complete a record release authorization.
Mm-hmm. Which of the following must be provided to the patient on a first visit?
Notice of privacy practices.
Mm-hmm. Who should be getting the pre-authorization for an inpatient hospitalization?
The provider performing the procedure.
Mm-hmm. New patient leaves the office because they don't accept his insurance. Which of the following actions should you take to prevent this? Are we wasting my time? Tell me up front.
New patient.
Advise, no. Verify.
Verify insurance eligibility prior to scheduling new patients.
Mm-hmm. Yep. What's the best way to greet an established patient?
Good
Good
afternoon.
afternoon, Ms. Johnson.
Mm-hmm. Mm-hmm. Some patients, you are going to remember them. And some patients, if you work in a big facility, you probably won't remember none of them people unless they come a whole lot. All right, last but not least, scheduling or booking, whatever they want to call it. Which of the following booking types involve scheduling more than one patient at a time with the same provider?
Wave.
Wave.
Are you sure?
Clustering.
Double booking?
So
No.
more than one patient at the same time with the same provider.
Wait,
Wait.
Are you sure?
More than one.
or still within an hour. Yeah, it has to be waived. I mean, it's 9 o'clock. I think that was the first thing you mentioned. Everybody gets the same time. It's a first come, first served
The same
basis.
patient, would it be cluster?
Cluster,
Oh,
clustering.
It's
yeah.
the same patient at the same time with the same provider.
To see all scheduled patients. So it's clustering. So it's like the OB, right?
Y'all didn't read them packets, did y'all?
I did read the packet, but when it came to clustering, it said that you book patients like that. You cluster them when they all have the same ailment.
Double booking.
Double booking is when two
Yep.
patients are scheduled to come at the same time
Yeah,
to see the same provider.
You're
Oh,
right.
You're right. You're right.
Mm.
I got it right here.
Some of y'all ain't read that packet. Some of y'all.
I know.
All right. Which of the following is the most effective way for the MAA to reduce the number of no-shows? Find them. Oh,
The third one, call patients 1 to 2 days before a scheduled appointment.
I know some, I don't know if you guys have experienced this, but some of the providers I go to, if you don't confirm that appointment, they cancel your appointment.
Yeah, real quick. I get like a text message, a phone call.
All right. Several patients cancel their appointments for the day. What's the first course of action?
The first one call the last patient of the day to see if he can come in early.
Contact patient who
Who
are
are on waiting list.
Every patient we see is a claim form that we can potentially send out. So forget the people who are later. Let's get some of the people who are not even on the schedule. All right. MAA is scheduling a patient for the procedure. What are the actions you need to take first?
Ensure that a signed consent form is filed in the patient chart.
Before you do that, first, you need an order.
Verify the patient's insurance.
You need an order.
Oh.
You can't schedule nothing until you have an order. That's the very first thing. That's the first question they're going to ask you. What's on the order? Okay. Which of the following is required to establish medical necessity on the patient encounter form?
A diagnosis code.
Which of the following is the purpose of a matrix?
I'm going to guess on this one. The first one, to create a flexible waiting time for the patient.
I think it's to indicate when a provider is unavailable to treat patients.
I think that's right. You're right.
Because you got to know what you don't have available. All right. It's just like on my schedule. I have a little button that people can click on my calendar to schedule an appointment with me. And I will go in and purposely block off times so that I can do stuff that I need to do for me. Like I block off lunch. And usually my lunch is blocked off from 12 to 1. But I'm got you off at 12:30. So I just skip that. Not skip it, but I only do a half an hour. And then if I got doctor's appointments and all of that, I block that off on my calendar. So first of all, so I can remember not to schedule anything. All right. When a provider requests a patient to have a diagnostic test at the hospital, which of the following actions should the MAA take?
Should it be the assistant should schedule the test with the hospital?
What are the two types of booking?
Book and computer.
Book and computer. Lord Jesus.
That's a trick question right there.
Yeah, it is. Ooh.
Which of the following actions is appropriate when you got somebody that's anxious?
Assure the patient that he will be okay.
Mm-hmm. Mm-hmm. Are you sure about that?
I thought it was involve family members if the patient.
Who said family members was there?
Oh, okay. That's true. Allow extra time to reinforce the instructions.
Mm-hmm. Which of the following actions is appropriate for a MAA to take before scheduling the patient for surgery? Cha-ching.
So he has to verify the patient's benefits.
Mm-hmm. All right. Provider is 30 minutes behind. What should you do?
Informed, let's see. Yeah, inform waiting patients that an emergency has caused a delay in the schedule, and they can either wait or reschedule.
Mm-hmm. MAA instructs a patient to arrive at 9 a.m. for a cast removal because that's the only time we do them.
Blustering.
Mm-hmm. Which of the following should the MAA consultant consult? I'm gonna fix that right now. To find the proper method of scheduling an appointment for a particular office.
The practice policy manual.
Mm-hmm.
I'm about to say it was right there.
Which of the following describes stream scheduling?
A patient's appointments from 9 to 9:15.
The providers, yeah.
What happened?
Is it the last one?
It is the last one. Because that's a regular timed appointment.
Right.
MAA is providing the patient with instructions about an upcoming mammogram.
So you would ask the patient.
Make sure,
Ask the
remind,
patient
no,
that you
I would
ask
say
the
ask the
patient
patient
to
to
restate the
reinstate the
instructions.
instructions.
Yep. Patients are scheduled at the same time each hour to create short-term flexibility.
That's that wave booking.
Wave.
Mhm.
Weave.
This type of booking is usually not a good approach.
Double.
Double.
Yep. When entering an appointment in the appointment book, the NP, we use the abbreviation NP.
New patient.
New patient.
Patients, please find below the phone call that cannot be handled by the MAA.
Patient requesting emergency medical advice.
Mm-hmm. When scheduling the surgery, it is not necessary to contact who?
Patient's family members.
Family member.
Yep, that is correct. All right, so tomorrow is our last day together. So you will have basically the same questions again tomorrow, but all in one, at one time. They're gonna be scrambled up. So I highly recommend that you listen to the recording. hopefully once we log out, it will upload or it will process before I leave the office. I'm leaving the office at 2:30 because I got a nail appointment.
Ooh, pretty,
I
pretty.
know, I need that.
It's been a while, so
Yeah.
I need to take care of it. I'm tired of looking at my fingers.
Yeah.
Ain't ready about it. I'm waiting for my hair salon to open up so I get my hair done.
Yeah, I gotta go get mine done today too. It's a hot mess.
All right. Everybody good?
Yeah,
Yes. I appreciate you for going
Yes,
over
everybody's
those
good.
answers because they did help.
yeah.
But read that packet.
I know I gotta get, I read a lot of them, but some of them I still gotta get to. So yeah, I'm trying.
Yeah, because they thick.
Yeah. And then you gotta print everything out. So I gotta get some more ink.
All right. You don't have to print it out, but I guess you can if you want to.
Well, that's how I study better.
Mhm.
Looking at the computer from morning up to sundown is getting to me.
Yes, yes.
Yeah.
All right. Well, everybody have a good day. See you tomorrow afternoon.
Thank
Thank you, Dr.
See y'all
Campbell.
tomorrow.
Same to you.
Okay. Bye-bye.
Okay, bye-bye.